The key shared goal that we have as senior living communities and as technology providers is really to provide the best care possible to seniors. And in order to do that, we need to see the earliest signs in the onset of a condition that is evidence that their health is declining. And for years, we've been looking at reactive solutions. And at that point, whether a senior has fallen or suffered a UTI, it's too late. In terms of what we've seen in the industry, 1 of 3 seniors fall annually, and which equates to, as you move into an assisted living community for 85-year-olds, they're 4 times more likely to fall than 65 to 75-year-olds. For years, technologies have been developed to react when a senior has fallen, and whether it's an automatic fall detection or they push the button to alert the staff to come, but they're solving the wrong problem, because the real solution is to predict and prevent the fall. In senior care, and we're seeing this globally, we have a shortage of caregivers to provide care to seniors. And what AI can do in this context is truly augment the caregiver. So what we're doing at CarePredict is the wearable device is worn on the senior's dominant arm. It's picking up the kinematics of the wrist, subtle changes in gestures and motions and behaviors of that senior. We capture a baseline on that senior, and it's personalized to them. And then when that data goes outside of the baseline, we can now capture and flag it and serve it to the staff so they can intervene. I mean, that's really how we close the whole loop, is predicting and then intervening. 2019 now, with the ubiquity of other wearables, I think everyone's kind of warmed up to the idea of wearing a device that can provide, health monitoring solution. So that's been a big, in terms of adoption, a big key. For our product, though, it's even stickier from a consumer standpoint. Our product serves as a two-way voice communication from the staff to the senior and from the senior to the staff, so they can communicate back and forth right from their wearable device. We've also integrated it with antennas and RFID coils for access into doors, so it communicates to connected doors now. Our residents actually jokingly call our product the Magic Bracelet, because they put the product on, they open their doors, they don't have to carry a key around, it is their key fob. They can communicate via our wearable as a concierge button. If I have fallen, I can actually then send that message to a staff member and get that response to kind of soothe that senior, that they know that help is on the way. CarePredict's wearable communicates with a beacon system to identify the accurate room that they're in. So we're not using traditional radio frequency technology. So a lot of systems that use RF for triangulation inside a building can't get down to room level or clinical grade accuracy. So our solution allows us to know Mary is in the dining room. Mary is bringing food from table to face, and the exact duration of that activity. Seniors are actually getting tremendous benefit from the product, and we're getting increased lengths of stay in the assisted living communities that we're installed in. We've been increasing the lengths of stay on average by 4 months, which has been incredible, and also the staff's responsiveness. So the staff wear our product as well. So in the context of an assisted living community, we know where everybody is at all times, and whenever they need to coordinate care, they know where the other caregivers are. The result of that is we've seen increased, they're actually speeding up their response times by almost 50%. To look at those subtle changes, look at those cues that are downstream, and those changes in behavior that could predict when the senior's at risk for a fall. We're seeing tremendous results with that as well. We're typically picking up the seniors that are increased probability for a fall 1 to 2 weeks out. We've kept seniors at the center of this equation from the beginning, where we learned how lightweight the product had to be, long battery life, multiple functionality. Our solution hosts a variety of different sensors as well. So we're looking at things fundamentally very different than a conventional wearable that's looking at step counts, general activity. We're actually identifying the subtle changes and gestures that senior is making from their dominant arm. When we train our models, our neural networks, it's focused, all the training data is seniors. And that makes our job incredibly easier for us to make those predictions. If you're collecting data on, younger generations all the way through seniors, it's difficult to train those data sets. So ours has been very focused from the beginning, putting the senior at the center of the equation.